Suzanne, take it away.
Thank you so much. So I'm really excited to be here and with my dear colleagues, Russell and Bruce, who I work with on a daily basis at Veterans Healthcare Policy Institute. Russell and I co-founded VHPI, what did 6 years ago? I've lost track, however many years ago. Um, and I also serve on the steering committee of SOVA, the Save Our VA campaign of Veterans for Peace. So I feel very honored. Um, so I I want to start by um, just saying that I hope this discussion will highlight the very positive things that we can do to protect the VA and also protect government and government programs and government employees. I think that while we are assaulted on a daily basis, there's an amazing, and I hope Bruce will talk about that. There's just an amazing blowback to everything that they're doing, which is really very heartening. And I think that we have an opportunity to get our message across. I mean, in a way that we never have before. Russell and Bruce and I, and folks at VHPI and many others on this call, have been trying to educate the public about the VA and the Veterans Health Administration, Benefit Administration. We've been trying to educate people about the dangers of privatization. We've been trying to educate the media. We've been trying to educate veterans. We've been trying to educate VSOs. And, it's much more difficult to get people to engage in prevention than it is in taking action when there's a gun at your head. And so that's, I think, what we're seeing now. And so I think our biggest threat is really despair or people feeling like there's nothing that can be done. And it's just so heartening to see all the things that are being done. And just to preface this, um, and I know Bruce again will talk about this, that there's just hundreds of protests all over the country. They're basically throwing shit at the wall and seeing what sticks. And the minute they get any blowback, they they cancel the cancel. And one of the most heartening things that I was told recently was by Paul Cox, who I don't think is here, but Paul, as you know, is the board member of VHP, and he was the president of VHPI and is now the president of the treasurer. And he told me about the fact that he was going to the St. Louis John Cochran VA Medical Center the other day. We could go to visit a sick friend, and he walked into the parking lot, and this older woman was standing there giving out a leaflet to basically protest the potential firings of 83,000 VA staff and all the stuff that was going on. And it was like, call your congressman and support our unions and support our federal workers. And Paul, who's a long time, activist, and he takes every leaflet, and he went up to her and said, gee, are you someone from Veterans for Peace? Are you someone from the union? Are you someone from, where are you from? And she was just the wife of a patient, in the hospital who heard about this, typed up a leaflet, went to the copy shop, and was giving it out. Now that is really extraordinary. And that's happening all over the country. And I get news that people are, vets are coming to protest, and some of them are you, and some of them are people who voted for Trump, and people are really pissed off at what they're doing. And so this is like just a huge opportunity for us, I think, to educate them and to educate them about things that they wouldn't have listened to us if we talked to them about it, last year. So what are those things? Um, I want to read you something that I think kind of says it all. We all know what Trump said when he was president about not understanding why people signed up for military service because they were all suckers and losers. Well, now OPM is sending out things to VA employees. Which this is an FAQ that they sent out when they were trying to get people to resign, to deferred resignation. And basically, they're saying the way to greater American prosperity is encouraging people to move from lower productivity jobs in the public sector to higher productivity jobs in the private sector. So, what are they telling VA staff and VA patients and veterans? You are low productivity person, Denny and Bruce, and all you are, taking care of you is just, it's like the lowest of the low. And Amy and people working in homelessness to help vets, and every vet in this call is just a magnet for low productivity. And why would you want to spend your time dealing with these low people when you could be working in the private sector? I mean, what an insult to the veterans of this country. I mean, it's an insult to federal workers in general, but to veterans. And I think those kinds of statements, should be highly publicized. And Doug Collins should be asked, to explain why he thinks caring for veterans is a low productivity activity. And that's what they think. And what we're seeing, I mean, we come into this, and I'm not going to go over what happened, for the past, since 2014. I mean, we come into this with a bipartisan consensus in Congress that privatizing the VA stealthily through what we call the salami strategy is kind of the way to go. And that really we should be sending more veterans out to the private sector, and this will give them better care in a more timely fashion, more conveniently located, and of higher quality than that is provided by the VA. And that has been the consensus that has prevailed, sadly, among too many Democrats, and definitely among Republicans for the past decade. And it's spanned, the Obama years, the Trump one, and the Biden years. And sadly, Biden continued many Trump policies that weakened the VA as opposed to reversing them, like Mission Act access standards that allow people to go out into the private sector, even though they could get care more in a more timely fashion and even more conveniently located in the VA. Terrible HR policies that crippled VA hiring, failures to hire enough staff, failures to provide needed infrastructure improvements, and so forth. So we come into Trump 1 and Trump 2, and what we've seen is an unprecedented attack on federal employees and federal employment and government agencies and really government itself. And this has seriously impacted veterans. And I think this is what veterans are beginning to understand, and what we have to get across to veterans. So, and this is not necessarily in any order, but they started firing probate. First of all, they offered everybody in the federal government and people in VA this deferred resignation. Please leave, please resign. And the union and just sit around for a year or whatever, doing nothing. We'll pay your salary and whatever. And they had hoped, I think, for like 12% of federal employees or something like that to resign, and very few did. So that got abandoned very quickly. The unions and other groups really advised people not to take these take the bait, and very few did. So then they were pretty disappointed, and they decided to fire probationary employees. And so they probably fired about 2,400 probationary employees. And that has decimated many categories of VA workers, clinicians, and so forth. Then they started attacking VA contracts. Collins and Company canceled about 875 contracts without that they outsourced VA care to or VA activities to, just without thinking about what the implications were. They canceled the contract with the BU Brain Bank. They canceled the contract for research with the National Centers for PTSD. They canceled suicide prevention contracts. They canceled contracts with workers in Portland, Maine, who are providing radiation monitoring for radiation oncology and imaging. They just, canceled everything. And there's been a lot of pushback, and some of these contracts have been reinstated. And they decided, because of the pushback, that, we're not going to cancel 875, we're going to cancel 575. Now, what is interesting, I have a list of all the 875 contracts that was leaked to me. And what's interesting about this is how much work has been contracted out over the decades that could be done in the VA, which I think, is something that we need to think about, because one of the things I think we need to all be doing is, what is our plan for the VA? They're pursuing the wrong plan. What is our plan? And certainly, rather than canceling the contracts and having nobody do the work, a lot of this should be in-house. But the other thing is, if your plan is to privatize the VA, contracting out is how you privatize agency functions. So, they're contradicting their own plan. And a lot of these contractors are people that they love the idea of contracting out, and suddenly their contracts are going to be canceled. So that's an interesting phenomenon. The other thing that they've done is they've canceled the contracts of VA researchers who are on what's called NT, not to exceed contracts, where they're not permanent employees, they're on soft money, and their contracts are renewed usually every 3 years. And they decided to just, on a rolling basis, as these contracts were coming up for termination, not to renew them. So they started in February not renewing contracts of many researchers and planning to continue this in a rolling fashion. And they also halted the program where researchers who are paid by affiliates, like academic affiliates, to work on research projects in collaboration with the VA. That program was going to be halted. We wrote about it, and a lot of people, protested. Patty Murray and other senators, and Mark Takano in the House, and they basically pushed back or pulled back and said, okay, we're going to halt the cancellations for another 90 days. And then they reinstated the without compensation program. Now, obviously, if VA isn't paying researchers to conduct research, how are you saving money? I mean, it's ridiculous. They just don't want research to be done on veterans issues. The impact on veterans could be staggering, because many of these studies, or much of the research that VA conducts is clinical trials. And to suddenly, if you're, for example, if you have cancer and you're on a clinical trial for a particular cancer medication, and that trial is interrupted, because the researchers were fired, or the researchers or the survey methodologist or the coordinator or the whatever. Many of these contracts for research are multi-site. I mean, one for 35 different hospitals or whatever, and you can't just you cannot keep taking a drug if it's if the clinical trial is stopped, and you can't necessarily get care outside the VA or equivalent care, because how you can't guarantee that some private sector hospital is conducting the same trial. Um, so, and the same is true of all these probationary cancellations, and then particularly will be true since Collins announced that they're going to start firing in August 83,000 VA employees and bring the current 408,000 workforce down to something like, I think it was 300. I'm sorry, I don't have the figure in front of it, 399 something and change, which would be like, that's essentially firing like a quarter-ish of your workforce. And then they claim that this won't impact care. Well, really? I mean, who are they going to fire? Are they going to, they claim it's not going to be direct caregivers. Are they going to fire housekeepers who deep clean a hospital room when a patient's had C. diff or MRSA or some terrible hospital acquired infection? Are they going to fire food service workers? I mean, who are they going to fire that they consider to be non-essential? Their VA doesn't have, I mean, I'm sure there's some managers that maybe in layers of management we don't need, but the VA is understaffed, not overstaffed. And it's been understaffed, and it was understaffed in 2019. VHPI did a survey of VA and VHA and VBA employees in 2019. No, we did it in 2022, and it showed that these staffing levels were insufficient. So this is disastrous. This will have a terrible impact on patient care. To say that it doesn't is ridiculous, is ludicrous. Doug Collins said in his hearing testimony in front of the Senate Committee on Veterans Affairs that VA is not unique, that anyone can give cancer care, anyone can give any kind of care, that a patient is a patient is a patient, and the private sector can do as well in delivering care as the VA. We know that that is not true. Wait times in the private sector are longer than the VA. VA patients are more complex. Russell can talk to you about this ad infinitum, having taken care of many of them, thousands of them over the years. They have many more comorbidities. They have many more mental health problems. They have all kinds of military-related issues that doctors in the private sector are unable to recognize. And also the idea that you can take care of more, veterans with fewer employees, given the PACT Act that was just passed, where you're going to see a huge influx, and already seeing a huge influx of veterans, coming in because of toxic exposures. This is like ludicrous. I mean, Colin says the VA isn't unique. Let me just conclude by telling you one little unique thing about the VA that's fascinating. Telehealth. We've been fighting to have telehealth included as access to care in the VA for many years at BHPI, since they excluded telehealth in the Mission Act eligibility standards. Well, it turns out, we live in an era of telehealth, right? And people are talking to their shrinks on video. I talk to my primary care provider, etc. Well, in the VA, in 2018, they made a rule called Anywhere to Anywhere, which was bolstered in 2020, that allows any VA provider anywhere to take care of any VA patient anywhere via VA telehealth. So when you have a patient who needs a nephrology consult in Alaska or Wyoming or Guam or Hawaii, where there are very few nephrologists, that patient can sit in Fairbanks or wherever and talk to a nephrologist in Chicago through this Anywhere to Anywhere program. If a patient needs a mental health appointment and there aren't enough mental health appointments available in San Francisco, that patient can talk to a clinician in Boston who is available. That is not true in the private sector. In the private sector, in order to take care of a patient out of state, you have to be licensed in the state you're in and in the state where the patient's in. So how many psychologists or nephrologists or primary care docs or whatever are licensed both in San Francisco and New York State or Tennessee or Kentucky or whatever? So you are depriving people of an enormous resource. And this is true in every VA program, many VA programs. We haven't even discussed the teaching mission of the VA that is critical. We've talked a little about the research mission, but we also haven't talked about the emergency preparedness and memorandum of agreement of understanding that the VA has with the DoD. But I think that veterans are suddenly getting it, and the media is getting it. We've never had as many media requests about these issues or as much media coverage of the VA. And I think that our job is to keep these protests going, to educate people about what's happening, to never, ever say, we told you so, we tried to warn you, if you voted for Trump, this is what would happen? It's a bad idea to say that, even though you can feel it. And to really say, we know you didn't want this. He promised he wouldn't close the VA. He promised he wouldn't attack Medicare. He promised he wouldn't attack Medicaid. He promised he wouldn't attack Social Security. He said he hadn't even read Project 2025 and barely knew what it was. What is that, Project 2025? And so I think we need to be out there at these protests, leading these protests, talking to the media, talking to veterans who voted for Trump, and saying to them that every time you push back on the bully in the playground, they collapse. And that is exactly what they're doing. Every time we push back, they say, oops, we didn't mean it, And so we just have to keep pushing back and helping others push back. It's very exciting that Common Defense has just joined and initiated a campaign of its own. Hopefully more VSOs will do this. The VFW and PVA have been very good. DAV has not been that great. And I would suggest that anybody who is a disabled vet and who doesn't belong to DAV should immediately join and put pressure on them to be a little bit more outspoken about this, and should be, if you are a VFW member or a PVA member, or know that, compliment VFW and PVA, give them shout outs for the very strong stances they have been taking. So in conclusion, I'm very sad about this assault on American institutions, but very heartened by the fact that, veterans are chaining themselves to the White House fence, and, veterans are coming and showing up at these meetings and protests, and that people are like, making little leaflets all by themselves without ever having heard of Veterans for Peace. It's really very wonderful. And we just have to figure out how we can take advantage of it and, um, ride the wave effectively that we have helped to launch. That may be a mixed metaphor, but whatever. So thank you so much for having me speak. I hope I haven't gone on too long.